Hello everyone, I'm Dennis McCarthy with the Upper Allegheny Health System. Welcome once again to our program Inside Olean General Hospital. It's our news and information program about Olean General and some of the exciting things that are taking place there. News and information for you based on a lot of the things that are going on. The first thing I'd like to talk about this morning is our new publication for this summer, Elevate Magazine. Elevate Magazine is full of a lot of helpful information for consumers on health, information on the hospital, and health tips. The magazine is available now online at ogh.org. Go online and visit it. You'll see a digital edition, and we hope you enjoy the magazine. With us today is Tim Finan, who's the President and CEO of Upper Allegheny Health System and Olean General Hospital. Welcome again, Tim.
Thanks, Dennis.
This has been a really exciting time for the hospital. A lot of amazing things are happening over there in terms of our quality and our efforts in patient safety. And I know that this is the most important subject that any hospital can talk to an audience about is quality and safety. So why don't you talk a little bit to us this morning and bring us up to date about some of the things that are being accomplished at Olean General.
Well, Dennis, you're right. There's been significant investment in patient safety and quality initiatives in our infrastructure. The last show we referenced a lot of those initiatives, the intensivists up in our ICU. You may recall that Olean General is one of only 15 to 20% of the hospitals in the country with intensivists running the ICU. Our ICU obviously houses our sickest patients, and the clinical literature cites a 40% reduction in ICU mortality in ICUs run by intensivists. That in and of itself is a very significant patient initiative. But this past week, we've received a very good news that Olean General has been ranked in the top 5% of hospitals nationally for patient safety by Health Grades, a third-party group that reviews hospital safety and is the largest online source for consumers and patients looking to find out information about hospitals and physicians. And I'd like to speak about this award because we're all very proud of it. Over 4,700 hospitals in the United States were evaluated. The interesting thing about this recognition is that hospitals didn't opt in. You don't apply for the award. You can't opt out. All 47 hospitals are evaluated, and they're evaluated against performance with respect to 14 patient safety initiatives. And the good news is that there are only 236 hospitals who were selected for special recognition.
That's out of 4,700?
That's out of 4,700, and Olean General is in the top 5% of hospitals nationally in terms of performance. So we're very proud of that. And that is obviously a wonderful reflection on the diligence and the focus of our entire hospital staff and physicians.
And I think that's wonderful. And also, I think the extending news to that is this is an OGH program, but also in Bradford, our hospital there received equivalent honors.
Yeah, our hospital in Bradford was top 10%. And again, there were 379 hospitals, which includes Olean. Olean was in the top 5%, but the top 10% included recognition for 369 hospitals, and our Bradford hospital, also a member of Upper Allegheny Health System, was so recognized. So here we have our two Upper Allegheny Health System hospitals recognized. And there were only, in New York State and Pennsylvania as an example, only 28 hospitals recognized, and 2 of them were our Upper Allegheny hospitals. So both organizations can be rightly proud of that recognition.
That's very select company when you think about the fact that there are more than 4,700 hospitals that were evaluated. And this program, with the understanding, is it's a program that you are evaluated on no matter what. You can't say, I want to apply for an award like this. Is that correct?
That's correct. You don't opt in, you don't opt out. Every hospital is evaluated and the chips fall where they may, and they're looking at things like pressure ulcers in hospitals, bloodstream infections, catheter-associated bloodstream infections, respiratory failure following surgery, blood clots in legs or a patient's lungs after surgery. So there are, as I said, 14 patient safety indicators that are evaluated. And, again, this is a reflection of the commitment of our staff. I think it's a reflection of the investment and the infrastructure we have in place. Look at Dennis, everybody understands that every patient who walks through the front door of the hospital, whether they're coming Cleveland Clinic, Olean General, they'd rather be someplace else. And when they walk through the front doors of a hospital, the expectation is that we're going to do right by them. And they certainly don't bargain for an infection, a fall, a medication error, a pressure ulcer, as a consequence of their hospitalization. So, it takes, as I said, a lot of diligence. It takes having the right programs in place. And this award, this top 5% nationally for patient safety for Olean General, I think is a manifestation of the investment, the work, the commitment that takes place at Olean General.
It's a team effort, isn't it?
It is a team effort, absolutely.
That's great. The wonderful news, and I see you have the Health Grades pin.
Absolutely.
And you're going to see a lot of that in the coming months. Again, it's a great source of pride, and more than that, it's really a mark that the hospital has achieved a very high level of performance in quality and safety. I'd like to thank Tim Finan for being with us today. We'll be back in just a few minutes with our next guest. Welcome back to our show. We're going to discuss a topic that's, well, everyone's involved with because everyone has to do this, and that's sleep. Sleep can be a problem for a lot of people. It can be a problem to the point that it's dangerous, and there are certain conditions within sleep problems that can be addressed and are being addressed, but it's a health issue. It's not just an annoyance issue for someone sleeping with a partner who snores and all that, and it's much more than that. With us now is Penny Euler, who is the Director of Cardiopulmonary and Sleep Services for Upper Allegheny Health System, and welcome.
Thank you, Dennis. It's nice to be here.
It is a big problem, isn't it, for people to have be not only devoid of sleep, it's not just being tired in the morning, but it can be potentially dangerous to your health. Is that correct?
Absolutely, absolutely.
So they call the condition sleep apnea. So what exactly is that?
Sleep apnea is a disorder characterized by intermittent, complete, or partial airway collapse, which causes frequent episodes of apnea or hypopneas.
What's a hypopnea?
A hypopnea is a severe shallow breathing. It's a severe shallow breath. An apnea is a breath that has pauses one or more times and could be very severe. That pause could be 5 seconds long. It could be a minute or longer.
That's dangerous, isn't it?
That is very dangerous.
And why is it dangerous? Because it affects certain other parts of the body, the heart, for instance?
Absolutely. It actually affects your whole body.
If someone does stop breathing, and essentially what you're saying in apnea, if someone stops breathing, it puts an excess strain on the heart. Is that correct?
It does, and it can cause several health risks, such as hypertension, heart failure, atrial fibrillation.
What's atrial fibrillation for the common folks out there?
For the common folks, it's when your heart just starts beating faster because it has to work harder and harder and harder.
And that's not healthy either.
That is not healthy.
Sleep apnea can affect people at all different ages, not just older folks.
Absolutely. Infants, children, young adults, adults, and geriatrics, all ages. Everyone is at risk for sleep apnea.
So it spans the generational globe. It's a fairly big problem. There's a lot of folks out there that have sleep apnea and probably either don't know it or don't want to get help. But I guess how would I know if I had sleep apnea? What are some of the symptoms?
There are many symptoms. Loud snoring, excessive daytime sleepiness, restless and tossing when you're sleeping. You wake up, you might be gasping for air. You may wake up choking, sweating, nighttime sweating. You wake up in the morning and you may have a really bad headache. There's memory loss. It's hard to concentrate.
That's why I wake up in the morning and I can't remember anything. Okay.
You may need to come and have a sleep study.
Well,
memory loss. It also, you can have an onset of diabetes and hypertension. And let me explain this, exactly what happens when you have sleep apnea. For the normal person, when you go to bed at night and you breathe, the heart pumps blood over to the lung and picks up oxygenated blood, and it carries it throughout your body, and it supplies all of your organs and tissues with the oxygenation that it needs for those systems to work properly.
Right.
So somebody who has sleep apnea, when I talked earlier about the apneas and the hypopneas and the airway collapse,
Right.
when they breathe in at night when they're sleeping, they have either a complete collapse of the airway or obstruction or partial. So what happens is they're not getting enough oxygenation into the blood. So that's your loud snoring sound, because there's partial collapse of the airway, and that's where you get that snoring sound, because the air is trying to go in and the air is trying to come back out in that partial collapse. So then the heart pumps the blood to the lung, and it's not getting enough oxygen, and it's trying to carry it out throughout your body to all of your organs, to all of your tissues, so that they can function properly. And they cannot function properly because the oxygenation
It's just
isn't
not
there.
there.
So the heart tends to beat harder and harder and faster and faster. So there are your symptoms.
There's a lot of people out there who have this, and it hasn't been identified yet. Is that correct? There's a lot of percentage of people in the population who have not had this diagnosis.
Absolutely, absolutely. Approximately 5 to 10% of adults in the United States have sleep apnea, and 85 to 95% of those adults have not been identified with sleep apnea. So to simplify it, 1 out of every 4 patients have a risk for sleep apnea.
So we know there's a problem. We know what the symptoms are. We know how dangerous it is. So what do we do? What does someone do? How do we treat this? How do we go about getting at this? To, in some cases, save people's lives, and in terms of snoring, probably saving some people's marriages.
Absolutely.
But, how do we go about getting? You have sleep studies and diagnosis and things.
Absolutely.
Like that. Can you talk about that a little
Okay.
bit?
Well, it's very simple. If you have any of these symptoms, or you have concerns that you do have sleep apnea, you just need to go to your family physician and talk to him about your concerns, talk to him about your symptoms of sleep apnea, and they will refer you to for a diagnostic testing at one of our accredited sleep labs.
And they are at both our hospitals, correct?
They are. We have an accredited sleep lab here at Olean General Hospital, which is located in the Hampton Inn, and we have an accredited sleep lab at Bradford Regional Medical Center.
And not all sleep centers are accredited. It's not easy to get that.
It is not. It is accreditation. They set high standards for the golden standards, the best. So when you have your sleep study at an accredited center, you know that you're getting the best diagnostic care and the best patient care.
So when I come in for a sleep study, what happens? I have to spend the night
You do.
in one of the very comfortable locations.
You do.
Okay, what happens?
What happens? Well, again, you are a guest at our sleep center. They are a bed and breakfast type suite. They have ensuite bathrooms. They have cable TV, internet access, and we also serve you a breakfast, a continental breakfast in the morning when you awake. So when you're here at our guest, what happens is we actually monitor your body functions. The reason why we do that is because there's biophysiological changes that happen in the human body during sleep. So if you go back to your symptoms and you think about those symptoms, we're measuring your eye movement, we're measuring your brain waves, because your brain is constantly signaling the heart and your other organs to work properly to
Wow.
get that oxygenation.
So
So we're measuring that
Lots
activity.
of information.
A lot of activity going on there.
Okay.
We're also measuring how you breathe. We're measuring if you have those apneas or those hypopneas. We measure your heart rate. So we can tell when that heart starts working harder to circulate that blood to get that oxygenation throughout your body. We're measuring that.
Okay.
We're also measuring your percentage of the oxygen in your blood. So we know when that is starting to drop.
So we go through the tests. We spend the night.
Spend the night.
A lot of measurements, a lot of activity. a lot of data. And then after the physicians examine this, what happens then? You can come out of it and have certain treatment plans and maybe a machine?
Yes, you can.
Okay.
Okay, so once you're done with the test, actually the test is, it's reviewed by one of our board certified sleep medicine physicians.
Correct.
They send the results to your primary care physician or other physician who has actually ordered the sleep study. Once that physician gets the results, then they are able to prescribe the best treatment to take care of your sleep apnea.
And what might those be? What might a doctor typically prescribe for a sleep apnea problem?
Okay. There are several different things that they can order, treatments for OSA. It's going to depend on the severity of the study. It's
Okay.
also going to depend on how the upper airway structure is, and also the patient's medical history.
Okay.
So once they take all of that into, once they take a look at that, then they will prescribe the optimal treatment. The number one treatment for OSA is continuous positive airway pressure.
Explain that.
That is called, most people know it as CPAP.
Okay.
Okay? It's a small machine. It's very, very quiet. Usually sits on their bedside, has a little tube, and on the end of the tube is a mask. And that mask goes over the nose. Some people who breathe through their mouth, they have a larger mouth, larger mask that actually goes over the nose and the mouth.
What does that machine do?
It actually pushes positive pressure into the airway, which keeps the airway open so that it doesn't collapse. So when the patient breathes in, they're breathing the oxygen and they're not depleting their organs.
So the patient is no longer being interrupted by these collapses of blood vessels?
Yep.
And they're in eliminating the interrupted sleep and the stress on the heart and other things.
Yep, it actually takes the work of the heart off breathing.
And they also experience, I would assume with a machine like that, a better quality of sleep, a more restful sleep, and that adds to
Stops all of those symptoms.
quality of life.
Quality of life. They feel better, they have more energy, they're awake during the day,
That's
those
great.
types of things.
That's great. Did we miss anything?
Well, I would like to add, there are a couple other types of treatments.
Okay.
One is position therapy. They call it position therapy. And these are for very, very mild cases. Some people, they sleep on their back.
Right.
And when they sleep on the back, their tongue falls back and obstructs the airway. So they have snoring. So
Okay.
it's very
So
simple.
it's just lay in a certain position and help eliminate the problem.
Exactly. So what they do is they take a tube sock, they put a couple tennis balls in there, and they pin them on the back of your nightshirt. And when you go to roll over in your back, they're there. It's uncomfortable, so you roll back on your side.
Easy done.
Easy done.
Easily done.
Easy done.
If you know what the problem is.
Absolutely. There are a couple oral appliances out there for people who have a mild sleep apnea. And one oral appliance that actually pulls the jaw forward so the airway is opened more.
Right.
And the second one, it actually holds the tongue down so the tongue doesn't fall back into the airway and cause an obstruction. There are surgical procedures that sometimes they actually break the jaw and move it forward surgically.
Okay.
And these are for severe cases. They'll take the tongue and they'll actually trim the edge of the tongue off.
Because it's blocking.
Because it's blocking, absolutely. But again, those are for some severe cases.
You know, it sounds like it's a problem that a lot of people have, and they just simply need to have someone check it out, get to the doctor,
Absolutely.
and maybe have a study, and really increase their quality of life overall.
Absolutely. And anyone is welcome to visit any of our sleep disorder centers at any time and visit one of our sleep specialists for a free sleep apnea screening questionnaire.
That's wonderful. That's wonderful. Well, thank you for being with us.
Thank you. It was a
That's
pleasure.
Great information. And for more information on sleep centers at Olean General and Bradford Regional Medical Center, visit our website at www.ogh.org for full information. That's the end of our show today, and thank you for being with us. I'm Dennis McCarthy. Have a great day.